The anterior hip replacement has been developed in an attempt to reduce the complications associated with the posterior approach. If you've done your research in relation to hip replacement surgery, you would have heard of anterior hip replacement and posterior hip replacement. Anterior hip replacement is when the incision is in the front of the hip. Posterior hip replacement refers to when the incision for the procedure is in the back of the hip. The way a hip replacement surgery is performed traditionally is using the posterior approach and is associated with specific complications such as dislocation and issues with the sciatic nerve, causing numbness and sometimes even weakness down the leg. The anterior hip replacement has been developed in an attempt to reduce the complications associated with the posterior approach. It involves an incision in the front of the hip, splits the muscles instead of dividing the muscles, and has been shown to be associated with a much quicker recovery compared to the traditional approach. However, there are disadvantages to anterior hip replacement, such as higher risks that the implant may slip, known as poor osseointegration or subsidence of the implant, and higher risk of infection due to the longer and more technical operation. So in summary, there are advantages and disadvantages to the anterior hip replacement and the posterior hip replacement. It is more important that you trust your surgeon and your surgeon is experienced. It has been shown that higher volume hip replacement surgeons perform better in terms of producing a better outcome for patients rather than surgeons who perform low volumes of hip replacement.